Hi, everyone. Welcome back to UCLA Health's Medically Speaking. I'm Dr. Eve Glazier. Most everyone can picture the inside of an intensive care unit, or ICU, even if they have not been inside of one. And we've all seen images of critically ill patients connected to machines, alarms sounding, and clinicians moving quickly to perform life-saving interventions. If I asked you to imagine what it's like to work in an ICU, some might picture an exciting, adrenaline-filled environment, everyone rushing from room to room, heroically saving lives. And others might imagine something very different, the quiet heaviness of a 2 a.m. walk through the unit, passing a family member keeping vigil at a loved one's bedside, exhausted and afraid. Both are true. The ICU can be inspiring and life-saving, and it also can be emotionally demanding, humbling, and deeply human. Because no matter how advanced the technology or how skilled the clinician, the ICU is also a place where medicine reaches its limits. And where and how someone dies can matter just as much as how they lived. And today I'm joined by one of UCLA Health's leading ICU physicians, someone who's devoted her career not only to caring for critically ill patients, but to reimagining what dignity, compassion, and humanity can look like at the end of life. Dr. Thanh Neville is a board-certified pulmonologist and critical care specialist. She's also the medical director and co-founder of the 3 Wishes program, an initiative that restores dignity to dying patients, creates lasting memories for their loved ones, and supports clinicians doing some of the hardest work in medicine. Thanh, I am so glad to welcome you to the podcast and honored to share this remarkable program with our listeners.
Thank you, Eve. That was a really, really nice introduction. I loved it.
Oh my gosh, for everyone, I've been stalking Thanh since this podcast started to come be on this show, so this is extra special that she's finally here. And just before we get started, I just want to clarify something quickly for the audience. The 3 Wishes program is not related to Make-A-Wish Foundation. That is an effort that focuses on critically ill children. So with that in mind, Thanh, tell us exactly what is the 3 Wishes program.
So the purpose of the 3 Wishes program is really simple. It's really a program in which healthcare workers implement small wishes for patients and their families. And these are patients who are unfortunately dying in the hospital. People then ask, like, what are these wishes? And these wishes can be very varied. It could be something very simple as providing a family with a keepsake to take away, or it can be more elaborate, like a wedding, a birthday party, or get together, or bringing a pet from outside into the hospital in their final moments. We really define these wishes really broadly, and the definition is really just an act of kindness from a healthcare worker to a dying patient and their family.
It's just amazing. And you said to a dying patient, or sometimes we use the words imminently dying. What do we actually mean? Like, what do we mean by, I guess, a dying patient or an imminently dying? What does that mean for?
Yeah. For us, who work in the ICU, it becomes very clear that sometimes a patient is not going to make it through this hospital course. And usually the entire team has known that and has communicated to the family. So these are the patients who are not going to survive this hospitalization. And usually this has been, this has been communicated to the family so that they also know. And it is only then that the 3 Wishes program come into play. That, everybody knows that this is unfortunately a patient with a very poor prognosis who's not going to be able to go home. Or in the rare chance there are patients who are going to be discharged in hospice, we consider those patients eligible as well, because it is obvious that this patient is going to die soon.
Is there a story that kind of comes to mind that you can share that illustrates what granting a final wish looks like?
Yeah, I think that it's kind of crazy, but like the story that always comes to mind is actually our very first story. So, I was ICU attending during December, actually, and it was that same very week that my IRB for the 3 Wishes program actually got approved, and we were initiating that week, and it just so happened to be that I was also ICU attending on service. And I took over the care of this young gentleman in his 30s. His name was Adam. And it was very clear to me, and sadly so, that this gentleman was dying for weeks in the ICU. And perhaps it's only been in the last few days that everybody has come to the same consensus that, this is unfortunately a patient that was never going to go home. And keep in mind, this is a patient in his 30s. So, and his wife was also in her 30s, and they were young, and they recently engaged. They had just moved to Santa Monica to start a new life. And the thought of him dying within the four walls of the ICU was terrifying and really sad to her, of course. You know, this is a couple who loves to hike, loves their sunsets. Every day they would take a walk at sunset, you know, and reminisce about their day. And just the thought of him losing him in a sterile environment like the ICU was something that she didn't want her last memory to be. So what the nurses and I came up with, and we talked to her name is Sandy, was like, you know, Sandy, like, what do you think about perhaps bringing you, Adam, and your family outside for Adam's final moments? And she agreed, and she said she would really like that. Adam hadn't been outside for months, hadn't seen sunshine, you know. So it actually happened during we arranged it at the time of sunset, and a whole team of our medical team accompanied me, including the nurses, the respiratory therapists. You know, this is an area that we were taking him to was not familiar to medical care. You know, we had to take IV poles out, we had to take the ventilator out, we had to take extra oxygen tanks out with him to make sure everything was ready for that moment. So we rolled the ICU bed out, and his family came along with him. I handed Sandy a non-hospital blanket, and she took it and she crawled into bed with him. As the sun began to set, I actually disconnected him from the ventilator, and he died in her arms. I think that was a really, really powerful moment for all of us healthcare workers who witnessed it. But I think it was even more powerful to me after I brought Sandy back for an interview that was part of the research. And I said, you know, Sandy, I don't know if you remember, but I gave you this non-hospital blanket in those final moments. And she told me that that was the only way that she falls asleep at night, because that was the last thing that he touched. And I keep thinking about this scenario, you know, like this was a $20 blanket. This was something that clearly made a huge impact on all the healthcare workers who were involved with the care, but also this person and the ones that she loved. So yeah, I think that was definitely the most powerful story that I have.
My allergies are so bad. That's incredible. I mean, and it's just, I can't believe this was the first story.
I know. And the story even moves on further. And so so what happened was so we have the program running for, I think it was 5 years into the program or something like that. And we get this large donation of $25,000 from a person that I did not know. So I was very curious about, who is this person? That's very strange. And when I went a little bit digging, what I learned was that it's 5 years later, Sandy has gotten remarried. And this was her husband, her now husband, who made this large donation in honor of her late husband and the experience that UCLA provided, you know, those final moments. So clearly, I feel like that speak volumes as to what this program has meant to a person that, you know, who lost a loved one in her ICU.
And to everyone around her.
Yeah.
And it sounds like everyone who's involved in it. I mean, I can't even imagine the logistics. I mean, the way that you're describing it, it truly sounds kind of a little bit seamless, but the logistics of getting someone from the ICU to an outdoor space.
Absolutely. I mean, we are fortunate in that our ICU is connected to this area. There's a patio outside. But to be honest, the logistics that you never even have to think of, for instance, the bed barely fit into the door.
Of course, right.
And much less with all his IV poles and a ventilator and making sure there's suction somewhere. Is there an electrical outlet somewhere that we can plug into, you know?
But when I imagine this, it took a village. That's exactly what I'm imagining, though, is that, and I think that's what makes this so incredible for so many reasons, is that, you know, there's this love and presence and, you know, and dignity and wishes, but the idea of this whole team, you know, and under your leadership rallying to make this happen, I mean, that's incredible.
Yeah. It really is. And it's like, I always say, you know, people, this program is definitely created and meant for patients and their families, but so often it's also for the healthcare workers.
Of course.
I mean, I look around that day at the healthcare workers, like their faces, and everybody's crying, everybody's hugging each other. And that is such a powerful moment that, like, you know, gets lost when you're like running around doing all the craziness with the ICU day to day.
Right.
And in that moment, we realized we're all human, and it's just so powerful. And the togetherness is so powerful.
Oh my goodness. You mentioned that was even just like the first wish, but I mean, let's back up a little bit. Tell us a little bit about the genesis of the program. I mean, you mentioned an IRB, if you don't mind breaking down what an IRB is for the audience, but tell us about how you even got into this initiative.
So I'm going to say, you know, with full disclosure, that the Three Wishes program is not something that I made up, that I came up with. This was an idea that was published in the Annals of Internal Medicine by Dr. Deborah Cook, and she's an intensivist in Canada. And she started the idea and piloted it there and published it in the Annals of Internal Medicine. A palliative care physician brought that article to my attention, and we decided to start it at UCLA.
Amazing.
And we started at UCLA as a research project, you know, and the reason why we did that, because we also wanted to evaluate its effect, you know. So I'm so glad I did now, because otherwise I would never have these interviews that I would know how much it meant to families after they had walked away, you know. So often, like, we take care of patients and even their families, like, once they leave the ICU, that's the last you hear from them, and that's the last that you have their interaction with. But because it was a research project, I followed up with the individuals, you know, who received Three Wishes and interviewed them, and was able to, like, gain these additional stories and connections.
That's amazing. So did you, so it sounds like you had a palliative care provider who also kind of helped you launch it. Was there other people, kind of team members? Were you kind of just doing this yourself? Grassroots.
Yeah, it was that's like exactly how I would describe it to Eve, like grassroots, really. Like,
yeah.
Because, so yes, I mean, so when the palliative care attending brought this to attention, we did gather like a group of people who would be perhaps interested in participating and leading this along with me, like-minded people, you know, some people from palliative care, nursing champions who wanted to do this for their patients. But Eve, to be honest, like, what I rapidly learned was that this was not a program in which outside leaders like implement wishes for patients that were dying, and it was much better implemented by the healthcare workers who are actually taking care of the patient.
Right, and getting to know them and spending time.
Because those are the people who already know them.
That's a really interesting distinction.
Yeah.
Right.
So what I have found was that, like, what I could do best was to give healthcare workers the tools and encouragement to do these wishes. You know, for instance, providing blankets, non-hospital blankets that they can grab, these lenders can grab easily, give it to them. Providing little keychain keepsakes in which we put the patient's fingerprints on, and they can take that away. And what you said was really true in terms of, like, this was being a very grassroots moment, because how this started was that I applied for a $10,000 grant to start this as a seed pilot. That's what the grant was called, a seed grant, you know, really just drops a seed and walks away, right? And it was $10,000. And I remember, you know, I would be shopping at every, like, Black Friday, going to Costco, going to, you know, the cheapest Ross, or, like, you know, so I can maximize the number of blankets I can buy, the maximum quality, but, like, also the maximum quantity, so that I can get through as many patients as possible.
How did you come up with the blankets?
That's a very... I can't
I mean,
remember.
It makes so much sense. I mean,
you
but,
know?
you know, I have 3 kids, and so, like, the blankets, it's very palpable. And
Yeah.
But, I mean, the fact that you landed on the blankets is so interesting and just makes total sense.
It does, and I can't remember why, to be honest. Like, I think I was just shopping for things, and I was just like, you know, it'd be really nice for a patient who is stuck in the hospital to have something non-hospital
Not that
on
white
them.
cotton,
Right.
sterile.
Right.
Yeah.
It's like something cozy, something comfortable.
Yes.
But honestly, most of all, an acknowledgement from the healthcare team that this is not just a patient, but a
personal.
person.
Yeah.
A wife, a husband, a dad, you know?
Yeah, of course. That they're touching on them.
Exactly.
I mean, it makes sense. I mean, I think that It's so special that Sandy's, new husband, acknowledged that, I think, as well. And, with the donation, it just seems like an incredibly valuable, warm, and palpable keepsake. And, even though, like you mentioned, Adam, Sandy's husband, sounds like he was on a ventilator. He was likely, sedated. I think that, I'm guessing, I want to hear from you, but that he felt the blanket somehow.
Yeah. I mean, I think what I always tell patients is families is that we've certainly never been there, so we don't know, but we like to think that the senses of touch and hearing are the last things to go.
Yeah.
Yeah.
Absolutely. And also that just the warmth is in it, right? And so then when Sandy takes it home, it has, his warmth in his person.
Right. I mean, and I think more so the blanket with the fact that Sandy, his wife, cuddled up with him, under the blanket with him.
You mentioned some of the other kind of keepsakes at the bedside, and again, I love that this is inside the unit. I never thought of it like that, but that's exactly right. That the ideas are being generated from this kind of, for better or for worse, home inside this intensive care unit, and people taking care of people. Tell us about some of the other wishes that you've granted through the program.
Gosh, there's so many. I mean, I before I even go on to the more elaborate wishes, I do want to speak on and saying the keepsakes. You think that to be honest, the keepsakes, one of the most popular keepsakes.
I want to hear about the keepsakes. Yes, yeah.
It's a fingerprint of the patient's fingerprint on
a
little
just do
piece
that
of paper.
on the bedside.
Yeah, on the bedside,
on a piece of paper.
On a piece of paper, and then put it into a keychain locket with a frame. Mm-hmm. And we do that for. I can tell you that is the most popular keepsake that we have done.
It is, okay.
And it's so easy and so inexpensive. It's $3 a keychain or something crazy like that. And
it is. Do you or the care team or the nurses are the ones that do that?
The nurses do that. And, in the beginning, I would one of the nurses actually came up with the idea of giving them the fingerprint. And I was like, are you sure people are going to want this?
Yeah.
And the reality is absolutely yes.
Absolutely.
To be able to take something tangible, something personal, something very, very unique home with them that represents who their loved one means so much to families. And again, this comes through the interviews that, I asked them, do you remember the keychain we gave you? And they would pull it out of their purse. You mean this one that I carry with me everywhere?
Yes.
And then I had a family member who told me a lovely story about it, and which was that her brother had died very young of leukemia. And she told me that he was a very foul-mouthed younger brother who used the F-bomb every chance he got. So when they brought the idea of the keychain keepsake, she asked them to use his middle finger.
That's amazing.
So she tells me that, when she holds onto the keychain, it's not only holding on to his hand, but also when there's people she doesn't like, she also holds it up to them. And that was between her and her brother,
That's absolutely incredible.
Yeah. But in terms of other wishes, we've had a few also wishes that in terms the patient is awake and talking, For instance, we had a gentleman who had been stuck in the ICU for months because his blood pressure couldn't be sustained anywhere else. And we knew that something's going to bad happen and he wasn't going to survive, and we shared this with him. And what he asked for was a reverse funeral. And I love it. It's I love the idea. He's why have funeral when people, after you die, I want to hear about all the good things they have to say about when I'm still alive,
Definitely.
So he wanted his favorite food, which included tortilla chips of multiple colors. Well, the ones you get at a restaurant.
I love it, yes.
Which I didn't even know where to get, to be honest. And this is where, I feel like this is a program that also reaches out to the community, right? Mm-hmm. So I actually posted on my social media, I was like, does anybody know where I can get these tortilla chips? And an LA tortilleria reached out and volunteered 10 bags
That's wonderful.
for this gentleman.
Yeah. That's wonderful.
Yeah. So all his friends, his family came. He got to eat his favorite food, and then he died a few weeks later. We've also had a young person die in our ICU, and his mom had expressed to us that she wasn't willing ever to let him go because he's so young. He was in his 20s, but development delayed, so more like a 10-year-old, and he had really wanted to go to Disneyland.
Yes.
And so she felt really guilty that she wasn't able to take him to Disneyland. And what we did was, we reached out to some party companies, and they lent us Mickey and Minnie, and we brought them into his room, and his whole family gathered with a little party, and little kids came in for a really special like day. And it was not intentional or anything, but it was very much tied with like the family and the mom particularly finding peace
Yes. Oh my
after
gosh.
this, and eventually transitioned him to comfort care a few days later as well. Yeah. And then we've done weddings, which is like so bizarre, such a bizarre thing to happen in the ICU. But
I don't know, or not. I don't know. As you say it, it makes complete sense. I mean, what I'm really hearing you say though is just how you and your team are just really leaning into what matters for the patients and their families. Like, you're not imposing what you think is important or your value system, right? So if someone wants to get married and that's meaningful,
yeah.
I mean, that's a keepsake.
Right.
But tell me more about that.
Right. I mean, so we've had multiple, but I think one of the ones that stand out most was actually not in the ICU, but in solid oncology in Santa Monica. And it was a young woman who...
So for people just that are listening, that's just kind of cancers that aren't blood cancers. Yeah.
Yes. And basically she was engaged to be married, and she got diagnosed with this horrible aggressive cancer such that they put the wedding on hold and pursued aggressive chemotherapy. But regardless, unfortunately, the cancer still like returned, and a year later she was dying. And they wanted a wedding. So we made that happen. And I think in the courtyard over at Santa Monica Hospital was an absolutely beautiful event. I think what this case and many of these weddings shows to me, though, it's like, people have lives before they got sick, right? Yes. People have plans, and these like are really hard. Not only are these illnesses life-changing and affecting their health and stuff, but it also interrupts their lives dramatically. And many patients and families, especially in these final moments, want to complete that plan.
Yes.
And like you said, like everybody's different, like, and that's more than okay. It always makes me a little sad because I'm like, oh, well, they're going to be a widow, But if that's their wish, that's their wish. And we certainly also have had weddings where, it's a mother that wanted to see their son get married. So,
right. So it's granted for so many people often.
Exactly. And like you said, all these wishes are, I think what is really special about this program is it's not scripted, it's not imposed, and it's not a menu. It's really the healthcare working, getting to know the patient and the family and thinking about what they might need. And I'm going to tell you, to be very honest, a lot of times with how quickly patients die in the ICU in unpredictable manners, a lot of times that does turn out to be just keepsakes, whether it's like a keychain or the EKG or something like that. Or
so that's not just a keepsake. That's tremendous, though.
Yeah.
I mean, you're also, though, I think, reminding me that, and all of us, that, and I will tell you as a healthcare provider, right, and I've, worked in the ICU, too. It's hard, right, when patients are in their beds and they're connected to machines and they're covered in the same blankets. Often, and you're depersonalizing anyways, because as a healthcare provider, you're just trying to make it through the day and not cry all day, right? But these are people, and their lives aren't defined by how they die or what they die of. And so this is such an incredible way to bring in their whole personhood into these moments.
Absolutely. Absolutely. And I think that, like, what I think of is one of our nurses in the ICU told me that, like, that they told me that Neville, this Three Wishes program is one of the most meaningful things that I do in the ICU.
Yeah.
It's not giving them the antibiotics, not starting the pressors, it's not managing the ventilator. It's, taking them out for sunshine, the last moment of sunshine, if that's what they want.
Yeah. Oh my gosh, and it's really being part of another person's life. Being part of someone's death is also being part of their life in a really meaningful way. How many wishes have you and your team granted? So the pilot was in 2017? The seed,
yes.
And you started this garden, this gorgeous garden.
Yes. Oh my God, almost 10 years now.
Yes.
Yeah. So I think, I looked at the numbers recently, and I think we have fulfilled wishes for 2,500 patients, and a little over 8,000 wishes have been done. Yeah. It's been quite a journey, and I mean, I never imagined this. I'm incredibly proud of these numbers, and
Yes.
it's just like, I think speaks loudly to not just my efforts, but the fact that this is something like other people also believe in and have joined me and walked along my side.
Yeah.
And this is not something, like you said, takes a village. So like, it's not something that I would be able to have done by myself.
Oh my gosh. And I mean, takes a village, and I think a very willing, right? I mean, a willing village. This is, I think, reminds, I think, all of us why we would, why we want to be in this field.
Right.
I'm guessing from at least what you're describing, but just, I mean, is it very costly to grant these wishes? I mean, nothing compared to the cost of a ventilator, which I don't even want to get into, but tell us about just, just the cost of the program or just
Right.
granting these wishes.
Right. Yeah, so you'll be shocked, but like the indirect cost of each of these for each patient is $35. That's the average cost.
I'm floored.
Yeah, I mean, you can't get like a blood test for $35, right? So yeah, I mean, I can tell you, the cost of taking that whole family out for that last final moment outside
Yes.
was the $20 blanket. And sometimes it's an EKG keepsake
Right, like a
or
strip.
fingerprint keepsake. So
I mean, $30 for something that makes such a difference and something that families carry with them for the rest of their own lives.
right.
It's amazing. I mean, the program clearly has been. It clearly just continues to provide so many just priceless gifts to thousands of people. I mean, that's incredible, Ton. Thousands of people.
Yeah.
So it sounds like obviously you need to keep going. I mean, what has kept you from continuing beyond the initial pilot program? And then tell me how you're thinking about, I guess, scaling it. I mean, you were saying you didn't start here at UCLA, started with Dr. Deborah Cook, but I want to hear about, is this offered at all ICUs? And
Yeah. I
Please
mean,
say yes.
that is my goal.
Yeah. Oh, good.
That is
Okay,
certainly
good.
my goal. Like, I feel like people are always asking, like, what's next? My next is, like, I hope this to be available as many hospitals as possible throughout the United States.
Right. And using
I
this as a model and a
right,
best practice.
Right.
Yes.
Exactly.
Good.
So exactly. So what we have generated at UCLA is that we've made a Three Wishes toolkit.
Okay.
So for hospitals who are interested in creating a program similarly to ours, and so they don't have to reinvent the wheel, and we tell them like what has worked. Here are the presentations. What are some of the samples of the wishes? Here are the inventory that we provide.
It's great.
And I myself am also very willing to give talks at any of these hospitals who want to start a program, and then they get links to this program. And then right now I'm actually in the middle of a NIH R01 funded research study in which I'm implementing it in the safety net hospitals of Los Angeles.
Can you tell for our readers what a safety net
Yeah,
might be?
so a safety net hospital are hospitals in which that serve patients regardless of their ability to pay. So these are the uninsured population, usually the patients who are underprivileged, financially challenged. A lot of them are uninsured. And these hospitals in Los Angeles is All of You, LA General, and Harbor UCLA. So these these hospitals not only serve underserved patients, but in general, we think of them also as under-resourced hospitals. And the question really is, can we get a program like something like this to
Right.
work when the system's already strained and the healthcare workers are already overworked?
There's just less resources.
Yeah, and the patient populations is extraordinarily diverse and different. So we're implementing across 3 hospitals, and so far, people are really willing and to participate, and things are going really well.
Right. Oh,
Yeah.
that's so great to hear.
Yeah.
How do people find out that the program exists? I mean, let's say they are in one of our UCLA Health intensive care units.
Oh, the patients.
Yes, or their families.
The
I mean,
families.
yes.
Yeah. So that's a very good question, right? Obviously, if you've read about it, looked up about it, or something like that, you would find out. But most often, it's going to be your bedside nurse who brings it up to you. And in the hospital, in all the ICUs that we have at UCLA, we also have informational brochures about it that they can look through.
That sounds like a difficult question too, though, right? I mean, because in even just talking about the program, is then that person also sort of relaying that, you're at the end of your life and we'd like to do this for you?
Absolutely. So then we actually do wait until those moments come to bring it up to families.
Wow.
Yeah.
Yeah.
Yeah, because this program is not meant to substitute a goals of care discussion. It's not meant to substitute a talk about their prognosis.
Right.
It's really only after that has been done, such that everybody's on the same page, that we bring it up.
Have you brought it up to patients?
Oh, absolutely.
How do you say it, if I may ask? Yeah.
No, not at all. I think it's really interesting. You know, I think a lot of people approach it and they're like, "Oh, we want a script. We want to see exactly how you say it so that, like, you know, we can play this out." And what I've learned, Eve, is like it works so much better when you just start from a very organic place. Oftentimes, I don't even bring up the words 3 wishes.
Yes.
I can tell you, I certainly have said something, you know, at UCLA, we have this program, we want to honor your loved one. And, you know, are there any things that we can do to make this process a little bit easier or honor who your loved one is? And most of the time, blank stares, right? Families and patients are not used to being asked these questions about, like, you know, what non-medical stuff that can we do for you at these moments. So instead, honestly, what I do is I sit down and I say, you know, tell me a little bit more about who your mom is. You know, I know her as a sick person with cancer, but, like, I don't know who this person is, you know. And this is a person who loves this types of music. This is a person who loves to dance. This is a person who likes to, I don't know, go take bike rides or something like that. Or loves to cook, or, you know, loves to drink margaritas, whatever it is. And this is where we have the opportunity to suggest things.
Yeah.
And that's precisely how I do it. So, you know, bringing up wishes this way, like, oh, you know, how about we play some of that favorite music your mom loves in the room?
I love it.
And one of the unique things that we do are word clouds. And really, these are just like pieces of paper that we smash up the words that describe the patient into a picture, and that we then frame.
That the family's described? Yes, I love. That's great.
And what I love about it is that, you know, this is a moment that we can really use to say, you know, let's not think about this is a dying patient, a dying patient who's connected to a ventilator who's about to expire.
Or this is a disease, you know? Right.
Exactly. And then certainly this is not patient 43 or something like that, you know, and give the family a piece of paper and say, you know, write out all the words that you think of when you think about your loved one. Yeah. And it's amazing. Like, suddenly, you know, it's not patient 40, it's not 45-year-old whatever, it's dad.
Yes, right.
And you see all these words, and like,
do you put the word cloud like above the bed, or can everyone see it, or is it?
No, we usually
private.
print it, and then we give it to the family, and then they do what they want with it.
I love it.
But like, what I've heard is, like, it's been blown up to poster size, made into T-shirts for people. Yes. Yeah, so people go wild with that. Like, and I love that's one of, like, I feel like a really unique keepsake, but also not just a keepsake, but an activity that the family participates in.
Yeah, and it brings a tremendous amount of humanity, I think, too, then the whole care team, too, as we learn about who we're taking care of.
Exactly.
And, you know, and you mentioned, too, that, right, I mean, I mentioned this in the introduction, I mean, it's a really intense place, the intensive care unit, for everybody. Do you find, I mean, I just really want to ask you this, do you find that in bridging, right, this humanity with your patients and their families, does it make it harder for the care team, or is it easier? You know what I mean? As we're trying to metabolize caring for people, right, but at the same time kind of having some distance. I mean, how do you sort of balance that?
Yeah. You know, I've been asked that multiple times. I mean, obviously, when you can imagine me talk about 3 wishes at a party or something like that. I'm not like the life of the party, right?
You're like, listen to this time. Yes.
They're like, what do you do, Todd? And I'm like, do you want to hear about this?
Let me be honest. I would never stop talking to you. But yes, of course.
But but I mean, I think, like, one of the realities that we forget is that as people who take care of the sickest patients in the hospital, like I do, and a lot of my colleagues do, is that 20% of our patients die. That's the mortality rate. So that sadness and these deaths are happening regardless of whether we do 3 wishes or not. So I think that the addition of the 3 wishes program, the existence of the opportunity to provide these wishes for patients and their families, really make the whole process easier and better.
Absolutely.
And, like, it's kind of ironic, but if anything, Three Wishes provides a light in the ICU. You don't.
Oh, I completely see that.
I'm
Yes.
so glad you can see
Yes.
that. You don't usually
I
associate death with light. You know,
No, but I mean, you either lean into it and say like, listen, as I was thinking about it, this is a part of their life, you know, and so
Yeah.
how do you make, you know,
Yeah.
their whole life, you know, as fulfilled as possible? I mean, it's incredible.
Right, right. And I remember, like, during the pandemic, right, like, it was, I honestly thought, like, that the Three Wishes program would disappear during the pandemic, you know, how are we going to do weddings? How are we going to do any of this stuff,
Right.
you know? But what I learned was that it was needed more than ever.
More than ever.
Because, you know, now, like, patients were dying without their families at the bedside, giving them a keychain or a keepsake or a EKG meant
And you
the
couldn't be
world
with
to
them. It's terrible.
Exactly.
Yeah, but it's
And,
so
like,
meaningful.
Right. And it was meaningful for the nurses and healthcare team. Like, literally one of the nurses approached me and said, you know, Dr. Neville, I'm so glad we already had this program in place before the pandemic started, because otherwise what will we be offering?
Right.
It was a really hard time for all of us, and, you know, never would have thought, you know, an end of life program. Thank goodness for the end of life program, right?
Absolutely. I mean, but you're really I think you're really just celebrating, you know, again, an individual. You're celebrating one's life when you're leaning in and saying, like, what are these other things that matter to you, right? And so whether it's a food that they like, right, or even being outside, I mean, I just can't think of a better way, you know. Again, in a situation where, you know, you are dying, that to have something that's still you, and
Right.
that then the people around you and who love you get to keep something of you.
Absolutely.
I mean, I think it's just incredible. I do want to ask you, because I've heard you speak about the program, and every time I'm like, gosh, what can I do to help more in the program, or get involved, or even like donate? So I mean, we'll include, you know, the toolkit, which in itself is a gift to everyone, right?
Yeah.
Here's this toolkit, anyone can, you know,
Right.
have access to it. Is there any other ways, you know, kind of to get involved?
Yeah, that's a tough question,
Yeah.
because I think a lot of people like yourself hear about it and, like, you know, want to volunteer about it for it. But, like, the reality is that, you know, deaths are not predictable in the hospital.
That's right.
You know, not time, you know, like, I think in the beginning there were people who were like, oh, I can always volunteer Wednesday afternoons. And I was like, well, I don't know what's
Right.
happening Wednesday afternoons.
And right, exactly, it's a very unpredictable
It's very
environment.
unpredictable. So what I have found that works really well is for participants to have a certain skill set that they like want to volunteer, whether it's like singing at the bedside or
In case
you
someone
know,
wants that,
right?
yes.
Exactly, having a list. And the other thing that we also have that has been very popular is fingerprint paintings. And this is something that we actually involve the college students. And how it started was with a volunteer actually during the pandemic. And she had approached me and said, you know, I used to draw, I used to paint at the patient's bedside, and I can't do that anymore. What can I do for the Three Wishes program? And what we came up with was these fingerprint paintings. And so what the healthcare worker does would take the patient's fingerprint and put it on randomly on a blank piece of paper, canvas paper, acrylic paper. And we would then deliver these pieces of paper to the artist, and they transform it, incorporating the fingerprints into a beautiful painting of whatever the patient had you
beautiful.
know, family wished for. So we have those volunteers as well. And then lastly, I think like kind of cheesy, but like the very easy logistic part is that donations are always appreciated. As you
Sure.
have mentioned, it's $35 per patient. So, you know.
And there's thousands of patients.
Exactly. And a
Right.
little goes a long way.
I mean, yes. Well, that's really helpful to know, and we'll incorporate, you know, a link. I really, really do. Right. And even if it's a fund, right? Because like you were saying, like this is grassroots, you know, every wish is very different, individual and personal. Right. So it's like, I was thinking, like, just as you were talking, I was like, oh, so like 50,000 blankets. And you're like, no, actually, because each blanket, actually, it's probably very personal to the patient if that's what they're wanting.
Yeah.
It's really, really incredible work. And it's incredible to see even these wishes, like you mentioned, you know, the Disneyland, right? I mean, that seems logistically, right? It seems like, oh my gosh, how are we going to get this kid to Disneyland, right? But you
Right.
brought Disneyland.
Right.
But then the additional aspect of the closure for the mother and I'm really alleviating kind of that guilt for her is it's just amazing.
And I have to say, even to expand a little bit on that Disneyland wish, his other wish was that he really wanted, he really loved Rihanna.
Yes.
So Mickey and Minnie brought Rihanna music and rocked out to Rihanna in his room.
I love it. Did he love it?
He loved it. He loved it.
That's amazing. Has there any other wishes that kind of have stood out for you?
I have to say, you know, I really love one of the newer things that we've been doing the past maybe 3-4 years is these heartbeat songs.
Okay, tell me.
So basically, this involves a music therapist, but we would get a recording of the patient's heartbeat. Mm-hmm. So that in itself is very powerful. You know, this is the patient's final heartbeat when they were alive. And then our music therapist would then work with the family and write lyrics to a favorite song, a melody or something like that, and personalize and make the song really unique, and then sing the song and incorporate the heartbeat recording as the drums in the background. And then we would then put this in a little sound box and put it in a stuffed animal, a teddy bear or something like that, and give it to the family.
I don't even have words for how meaningful this is. We actually have a clip of one of the heartbeat songs that you and your team created. Any background that we should know about this particular patient or family that this song was written for before we kind of press play?
Yeah, absolutely. Yeah. This is about Stacy. This is one of my patients, I think. And she basically was a woman who loved to party. Her family told me that she loved music. She loved Fleetwood Mac. And she loved the outdoors and loved to garden. So that's the main background. And this song was written with the family, with their lyrics about her, to the lyrics, to the melody of Landslide from Fleetwood Mac.
Oh my gosh. Quick question. So the heartbeat, oh no, we'll listen first.
Yeah, but that's the heartbeat.
No, it's okay. Yeah, go ahead.
But that's the heartbeat.
You gave us love and you gave us life. A wild woman with sparkling eyes, lover of the sun and of the snow, tending to her garden and watching it grow. Magnificent Stacy, you can be free. Now you can be free to be you. Oh, confident Stacy taught us how to be. Thank you for loving me. Now you can be free to be you.
My glasses are filling up like goggles underwater. That's so incredible for so many reasons. I don't know how many times you've heard this, but I mean, I feel like the heartbeat was inside my heart when you're listening to it. Do you feel that way too?
Yeah. I mean, the first time I heard this song, I cried. I was just like, oh my God, this is so beautiful. And those words, to know that the family wrote it with, you know, free to be you. I was just like, oh my gosh. And I knew this patient because she was mine, you know, so like it's incredibly meaningful.
It's a keepsake for you too.
Exactly. I listen to this all the time. I listen to it many times, to be honest with you. And, you know, and we've now done over 100 of these teddy bears with these sound boxes and with heartbeat recordings. And now I've got a chance to talk to those folks too who received them. And people have told me they put their husband's T-shirt on them and hold the bear at night and listen to the heartbeat. I've heard a woman say, you know, this was like immediately after our big Palisades Eden fire, that she's like, you know, if the fire came to my house, that's the first thing I'm going to grab because that's the most valuable thing in my house. Just hearing those words, like, you know, I I don't doubt that we're making a difference.
Oh, no. What you do matters so much. It's incredible because you really occupy like both ends of this spectrum of this, like, you know, again, you literally do this incredible critical care, right, and pulmonology, and then you're caring for people on such this deep, humane level.
Yeah.
It reminds me, and I don't know if you remember, but your first, unless I'm mistaken, your first rotation as an intern was the ICU. Do you remember that?
You were my resident.
And I was your resident.
You were my resident. I do remember.
Yeah.
You were pregnant.
Okay. Yes. Maybe I was. No? Totally. Yes, of course I was. I was. And but what I remember is like you had just started, and it's really, really insane to start your residency in the ICU. Like,
yes, it is.
And it was very stressful, and we were both nervous.
Yeah.
And it just amazes me that when I think, because I really remember you, like, you're like, this is the first time I'm wearing a long white coat and the first time I'm rushing around the unit, and you're like running around like with trying to get all the labs. And I think of that, and I think of like what you're doing now in the ICU. And I mean, like, I have no right to be proud of you, but I'm just, my heart is just so bursting thinking about this, like this incredible, like, journey that you've also taken on, and this incredible
absolutely
work.
It really is. It's been an incredible journey, and also just to speak of that spectrum, you know, I went from like going into critical care because this is where the action happens. This is where lives are saved. This is where all the crazy is. Yeah, this is so exciting. To the realization that this is where the most humbling things happen, and this is where hearts are broken. Yeah. And then to the very end, where like, how can we help these broken hearts and help the healing begin after that?
Yeah, exactly. This extreme of like literally like managing the ventilator settings to imprinting someone's thumb or their middle finger, you know, on a piece of paper. I mean, it's just, it's deeply moving, but it's also just, I can't think of anything more important.
Oh, thank you.
I can't thank you enough for coming today and sharing all of this with us. I mean, I think for those, you know, who are listening too, I mean, I think it's, you don't have to be dying in an ICU or have a loved one dying in an ICU to, I think about and integrate the everyday act of kindness, right? And the presence, and truly just thinking about what truly matters, you know, wherever you are.
Yeah.
You know?
Exactly.
Is there anything else I didn't ask you that you want to share with us? I'm so grateful that you're here, and I'm so grateful for the work that you do and you lead.
Thank you. No, actually, I don't. I think we covered everything.
Okay. Thank you so much for being for our listeners. Until next time, stay curious and healthy, and thanks for listening to Medically Speaking. And Dr. Neville, thank you